ladies and gentlemen, everyone, welcome to this special series on talking to doctors, and it's hosted by Cancer Voices SA, South Australia. My name's Julie McCrossin, and I was treated in 2013 for stage 4 throat cancer, known as oropharyngeal cancer, and I was treated with radiation and also chemotherapy. And the purpose of this series is to share some practical tips about how to achieve the best possible results from our conversations with doctors, particularly in those early days of diagnosis and treatment, but also in the period of recovery. And it gives me great pleasure to welcome John Frasier, who I think, John, welcome. You've been treated for more than one cancer. Can you just tell us, what have you been treated for and what was your treatment? Welcome.
Right. Well, so my first experience was with a lump in my throat. And it seemed straightforward. We have the lump, we're going to take it out. When they did the biopsy, they found the cancer had spread into my lymph nodes. And so we had another surgery to remove all of the lymph nodes in the soft tissue in my neck. And then that was followed up with a series of radiation. And that was in 2001, and I've been cancer-free in my neck since. Yeah. And in 2013, I started having high PSA readings on my annual checkup with my GP. And so PSA is an indicator of prostate cancer. And so the simple answer is up is not good, keep it down, that's good. But my PSA continued to rise over time. And so you have follow-up tests. So then I was referred to a urologist who is a specialist in treating prostate. I had a series of biopsies, which were inconclusive. And then I had an MRI on my prostate, which showed there was cancer. And the good news was it was in my prostate and could be treated. I was offered robotic surgery, and I asked for a second opinion and was referred to Professor Sandra Turner for radiation treatment, and I was accepted for that, and I made that decision, and that's an important thing, how that decision came to be. And then I was invited to join a trial for a new treatment method called the SPARK trial, which, as you would know, radiation therapy is a whole bunch of visits to your friend, the radiation machine. This new treatment was much more specific and much stronger. So only 5 visits. And so I was a part of that trial for that new treatment. I just come up on 5 years of my treatment, and I'm cancer-free. So I've had 2 adventures, but the results in both were very good.
Well, that's an extraordinary story. Thank you for telling that to us. I mean, obviously, you've had a lot of conversations with doctors. So, so I guess I'm interested, first of all, what do we aim to achieve in a conversation with a doctor when it's important, like when you're dealing with the sort of serious cancer diagnosis you've had? What is your primary goal?
Is to not look stupid and to be able to talk to your doctor and absorb all of this information that is foreign to you. You're not used to it. You haven't experienced any of this. And you're told about various test results are important, and you have no idea what that test is. So to me, the first thing was to understand enough of it that I could ask questions about myself. Well, how does it relate to me? And the person that is the key to that is your GP. Over the last 25 years, I've had 2 GPs and long-term good relationship with both of them. And so you can talk to your GP and say, I have this is not right. And they take it as, I'm going to refer you to a specialist. Oh my goodness. What am I going to have to do there? And you put the pressure on yourself about how you perform for your doctor. So it's a good idea to go over the kinds of questions you should ask or can ask, and work that out with your GP, because they know everything about you. and they know how this diagnosis fits into your overall health.
Okay, so your number one tip is work with a general practitioner. So I guess implicit in that is to find a general practitioner that you're happy with if you don't already have one, and work with them as a team. What would be another challenge and another tip?
Yeah, so try to get a way to find the information that you need. So for neck cancer, my neck cancer, it wasn't so precise. It was a lump in my neck, and then everything else became treatment related. So you had a lump in your neck, and we removed it, and that pushed us to this treatment. So that indicated we should go from that surgery to another surgery to radiation. So that's kind of a straightforward and easier to understand and easier to talk to all your doctors with. Prostate cancer is a whole nother kettle of fish. The first, and I'll put it this way, the first specialist I spoke to made this statement: most people die with prostate cancer rather than die from prostate cancer. So the scope and the scale of your cancer is totally different, and they will all give you references, and you can look get information about prostate cancer. But there are many treatment options, and there are many ways to approach it. So you have to do two things. One, you have to make yourself comfortable with your diagnosis, and then you have to make yourself comfortable with your relationship with the specialist.
Could we go to the first one first? How did you make yourself comfortable with your diagnosis? Explain what you mean and then what you did to achieve that goal.
So for me, I'm kind of a curious person. I've been technical kind of thing. So to me, it's easy to go find information. I'm quite happy, quite easy to look up things on the internet and all that. And the resources available to you for prostate cancer in particular are immense. Everybody will give you a book from the Cancer Council. It's a whole 100-page booklet about prostate cancer with all the variations and the treatments and all the explanations and all of the side effects. So that was fine for me. But the hard part for me was, how did I feel about having cancer? Not knowing about it, but how did I feel about having cancer? And everybody looks at you a little bit different. Your relationship with your family and everything, they all want to be supportive and all those things. So that's the hard part. I got through that okay, but I don't think a lot of people do. I think that's a really hard thing, because and that goes back to trusting your GP to put you in the contact with somebody who can help you with those feelings. I would call them feelings. I mean, it's scary, you know. It's a big killer of men in Australia.
Could I ask you, often there is a prostate cancer specialist nurse who can be a resource, and on some cancer teams there is a specialist psychologist who can help. Any thoughts on the specialist nurse or the use of a psychologist if that feelings issue is making it hard for you to think and to concentrate in the conversations?
Yeah. Well, again, two things. One is that I had my prostate cancer treatment done at the Crown Princess Mary Cancer Center at Westmead. Professor Sandra Turner was my oncologist, yes. And there was a team of people that worked with me through the whole process. I mean, from the time that I made initial contact with them and the treatment was completed, it was a year. So it takes a long time. There's a lot of preparation. There was a specialist nurse who worked with Sandra Turner, McHughes, and she was my kind of contact point if there was any kind of question. And then the treatment was managed by a lady named Alison Brown, and she's one of the scientists on the treatment plan. And she was there for every treatment. She made sure I understood as much and was comfortable with the thing that they were going to do to me, and what if I saw this happen, what that meant, and all this. So they're there to make you comfortable, and they know that if something's wrong, they know. they know if you're not coping with it.
John, you mentioned that there was a discussion about whether you should have robotic surgery for your prostate cancer, and then you got a second opinion and you ultimately went with radiation. Just in a nutshell, what went through your mind as you made that decision, and any suggestions to others who may want to ask questions of their doctors if they have to face that decision?
Obviously, when you go see a urologist with prostate cancer, their ability is towards robotic surgery. That's the kind of the go-to treatment these days, because it's very effective and all that. For me personally, having been through radiation and having experienced surgery and all that, I wanted the second opinion for me, because I didn't exactly like the idea of being cut. And a lot of people prefer that because it's quicker. To me, I didn't like it. And my opinion was that the side effects were higher risk in my mind. And so I asked my GP, who arranged the second opinion. And then after that meeting with Sandra Turner, I felt like I was capable of making my own decision, which was absolutely critical in my mind. I would be in charge of my destiny. And so I chose that. And so as it worked out, the treatment was successful, and the side effects that I was most worried about didn't happen. And all of those issues through the whole journey with prostate cancer is your fear of side effects.
And just for the uninitiated, two side effects of concern with surgery with prostate cancer can be erectile dysfunction and also incontinence. On the other hand, as you indicated, some men feel, I just want it out. And so it's an example of how the conversations with doctors and finding the mental space to think clearly are really important, aren't they?
Absolutely important, and because it's your decision, and you feel like you were empowered, that takes some of this mystery of medicine away. It makes it more human, more personal, and it was to me it was very important. I felt that way about it. The side effects, everybody is different about how they feel about it. To me, incontinence and bowel problems are the big issues. I had met some people over the years that were incontinent. I feared that more than anything. I don't want to be, 70 years old and wearing a diaper. I just didn't want that.
I think the first point we've discussed there is dealing with feelings and seeking help. And I guess another message I've heard from you is there is the general practitioner, there is the nurse, there was another member of your team. So ask for help from someone in your team. Now, what was the second issue you were going to raise?
Make it personal. Right? Don't operate on their terms, right? From my point of view, you're not a number. You're a patient, and they all totally go for that. For me, that worked out this way. When I was having my treatment plan made, I let them know that I wanted the treatment to be completed by July, because that was going to be my 50th wedding anniversary, and my wife and I had booked a house, and all of our family from around the world were going to meet in Hawaii for our 50th wedding anniversary. And that was very important to me, to my wife, all that. And Allison Brown, she was going on a family trip to Hawaii as well that year. So there was that way to make me not a number. And I didn't make that up. They made sure that I felt that. So I think that's a good understanding. They care. The other thing is, because it was a trial, a new treatment method, there were a lot of people that were also interested, because I was one of the first group of people that were on this trial. And so you see a lot of people that you don't really know what they're there for. And as you know, the first time you walk into the room for radiation treatment, you're in this gigantic room with this huge machine, and it's very intimidating. So for me, one of the things that Sandra and the team did was made sure I went into the room, the control room, as it were, where all these people were sitting in front of screens, and they showed me what they would see on the screen during my prostate treatment. So and they even showed me a picture of my prostate on one of the screens. So, they are working very hard to make you a member of your treatment, part of your treatment. It's very important, and I think the people do it very well.
Look, thank you. And I guess another takeaway I get from that for the newer people is that ask your doctor for visual information about what your treatment is going to involve. And if you can visit the radiation treatment area, or at least see pictures of it, or whatever other treatments you're having, the chemo room or whatever, but that can help you understand. We only have a few moments left. Is there any other important tip you'd like to give anyone watching this, patient or family?
Yeah, I think the main thing is to respect yourself, get the information, and to I think have faith in what's going on around you. These people are absolutely dedicated professionals. They are not there trying to scare you. They're trying to help you, but you kind of have to help them too.
Well, that's very interesting, because my last question is this. If a medical student or a newer doctor is watching this, what would be your one suggestion to them as they learn to have good quality conversations with patients? What's your tip for doctors?
Yeah, it's to understand the person, understand your patient as a person. And I'm 76, I've seen a lot of specialists over the years. Some are very good technically, but not so good personally. And some are really good personally. Those people that's the lesson to me, is that you're not intimidated by your lack of knowledge, but you felt like there was a connection between you personally and your doctor.
It's been such a pleasure to talk to you, particularly a fellow head and neck cancer patient, because mine was a head and neck cancer as well. And your thoughts are so perceptive and so helpful. So I just want to say thank you to John Frasier, a survivor of 2 significant cancers, and who's been offering his thoughts on how to have effective conversations with doctors. This is deaf sign clapping, so I'm just applauding you, sir.
Thank you very much, Julie.
Thank you.